Alright guys, we called to a clinic in North Burnaby for a staff member who's been acting confused.
Are there any hazards as I come into the building?
As you go into the room, it will be as you find it, no obvious hazards.
Since the individual is disorientated, I will be watching for any adverse reactions that they might have towards myself or my partner. What is the environment of the building?
Well-lit, clean, warm office around 11:30 a.m.
Perfect. Any mechanisms of injury that I should know about?
There's a coworker who tells you that they've been both working in the office since around 8:30 this morning. This coworker went to say hi around 9 a.m., brought a coffee, everything seemed fine. When he went back to see if the patient wanted lunch, she was acting oddly. They seemed confused and quite irritated.
Okay, and just the one patient?
Just one patient.
Perfect. So me and my partner both have our PPE on, our gloves and our masks. And as we're coming in, just because the situation I don't know too much about, if we could get fire or ALS on the way.
No one else is available right now. Dispatch will let you know if they become free.
Perfect. And then as I'm coming into the room here, do I notice anything in particular about the patient?
Patient seems alert, looks confused and anxious.
Perfect. Okay. Hi, my name is Malcolm. I'm with the ambulance service. What seems to be the problem today?
Leave me alone, please.
If I could just get you to put on the SpO2 monitor and the BP cuff for me, that would be
for
great. The individual appears to be alert. She is a little bit confused, but she is verbal at the moment.
As found.
Perfect. Just going to quickly check your C-spine. Is that okay if I touch the back of your neck there? Perfect. Just palpating the C-spine there. The mechanisms of injury didn't suggest anything, any damage to the spine. Her airways appear to be open. She is breathing on her own, and it is regular.
Breathing is slightly elevated but effective.
Perfect. Just going to quickly check your pulse here. The patient appears to have a strong, regular radial pulse.
As found.
Perfect. Okay, is it okay if I just take a quick once over on your body there just to make sure everything's okay? Perfect. Just going to come around here, checking on the head. No blood, no injuries on the shoulders. Coming down the arm.
See a bracelet on that arm.
Okay, bracelet there. Perfect. On the other arm there. Just palpating, taking a look down the legs. No blood, no other injuries.
Nothing else found except the bracelet.
Perfect. Yeah, what's on the bracelet there?
It says diabetic.
Diabetic. Okay. Skin appears to be normal, warm, and dry.
Skin is pale, cool, and sweaty.
Pale, cool, sweaty. Just going to check the pulse oximeter here. Getting a reading of 99%.
Oxygen saturation is 92%.
92%. Sarah, if I could ask you to go grab the stretcher for me there.
Yeah.
Perfect. So I am going to be administering oxygen here. I am going to be using a nasal cannula at a flow rate of 4 liters per minute. Get you here. Perfect. The individual is maintaining their own airways, so there's no need for any airway adjuncts. So we are now going to be moving the patient over to the stretcher there. We are going to be positioning her in 3/4 prone. I'm going to be using the lift and pivot technique here. Perfect. We'll just get you up here. That way. 1, 3. 1, 2, 3. Perfect. Get you just walk over here. And get you to lie down there.
You good? Awesome.
Perfect, Sarah. If we get her strapped in.
Yep. I'm gonna strap this in first. Cool.
Perfect.
Right.
Perfect. If we could just reposition her
Yeah.
here. Perfect. Just going to reassess the ABCs here. Her airways still are open.
Can you do with your
Breathing
head?
is normal, and her radial pulse is present and strong.
As found.
Perfect. Since this is a suspected diabetic emergency, I am going to be testing her blood glucose levels. Would you like me to test her glucose levels there?
No, just walk me through the process.
Perfect. Okay, so what I would do, initially I would grab her finger there, grab an alcohol wipe away from her finger there, making sure that the skin is nice and clean. Let that dry. Next, I would grab the glucometer, grab a testing strip, insert the testing strip, and make sure the monitor is on. Next, I would grab the injector, and I would find a spot on her finger, prick her finger, squeeze just to get a little bit of blood there, grab the glucometer, test on the strip, and I should get a reading of
2.8.
2.8. Okay, so she is low on glucose there. I would like to administer some glucogel. First, before that, I need to take a full set of vitals. So, do that here. Pulse is 62.
92.
92, and respiratory rate is 24.
As found.
Perfect. Just gonna recheck the skin there. Normal, warm, and dry.
Pale and dry.
Pale and dry. I'm going to check your pupils here. Pupils are pearl, equal, round, and reactive to light at 3 millimeters.
As found.
Perfect. We're going to take a listen to your BP here.
Yeah.
Perfect. Yes, thank you. Blood pressure is 120/80.
112/68.
Perfect. Just checking the SpO2 with the flow rate of 4 on the nasal cannula. It is at 99%.
As found.
Just going to be checking her GCS here. Her eyes are opening spontaneously and they are moving. Verbal, how are you feeling there?
I'm not sure.
Her verbal score is going to be a 4. She still seems quite confused, but is alert still. Can I get you to squeeze my finger there? Perfect. And for the motor, we're going to give her a 6. She is still obeying commands. So the full GCS score is going to be a 4.46 for a total score of 14. Next, we're going to be administering some glucogel. What we're going to be doing, we are going to be administering 15 grams of glucogel into the buccal pouch with a tongue depressor there. Do that. Perfect. Let that absorb there. Next, we are going to load and transport her to the hospital. Perfect, Sarah. We'll just get her out that way.
This way? Okay.
So we are now in the ambulance. Just going to quickly reassess the ABCs. The patient's airways are open, breathing is normal, and circulation is still present, strong radial pulse. How far to the hospital?
About 30 minutes.
30 minutes, perfect. Since this individual is still quite confused, I was able to grab some medical records from her office there, just to see if we can get any background information about what might be going on. So, the signs and symptoms. How are you feeling today?
I'm not sure.
Again, so still quite confused there. So, allergies.
According to the medical records, she's allergic to penicillin.
Penicillin. Down here. Any medications?
Insulin and Synthroid.
Insulin and Synthroid. Past medical history?
According to the record, she's an insulin-dependent diabetic. She also has hypothyroidism.
Last oral intake or outs that you're aware of?
Unknown.
Unknown. And then I do not know any of the events leading up to this. Is there anything that any of your coworkers said before we left?
No.
Okay. And again, for the OPQRST, I'm unable to get that just because she still is quite confused and cannot give me any responses there. Next thing we're going to do, going to be taking another set of vitals. We'll go through that here. SpO2 is still at a 99.
SO2 is now 100%.
100%, perfect. Just checking the pulse there. What's the pulse at?
90.
90, perfect. Respiratory rate?
20.
20, perfect. Just going to check the pupils there. The pupils are?
Still pearl, still at 3.
Perfect. Next thing, I'll check the blood pressure there. The BP is at?
You get a blood pressure of 118 on 70.
118 on 70, perfect. Skin appears normal, warm, and dry.
Pale, cool, dry.
Pale, cool, dry. Her eyes are opening spontaneously and still alert. I'm going to give that a 4 out of 4. How are you feeling today? Are you doing okay? Doing better?
I don't know.
Her verbal response, she is speaking in full sentences. Still a little bit confused. We're going to give that a 4 out of 5. And if I could just get you to squeeze my finger there. She is obeying commands, and her motor functions are a 6 out of 6. Her GCS score is a 14 out of 15. Next, we are going to check her blood glucose levels one more time. And they are going to read
3.8.
3.8. So that is just shy of the normal range there of 4 to 7. So we are going to administer another 15 grams of glucogel in the buccal pouch with a tongue depressor there.
Done.
Perfect. Next thing, we're just going to call the hospital just to let them know what we are coming in with.
Hospital.
Hello, so I'm Malcolm with the ambulance service. We have a 24-year-old female who is a known diabetic with a decreased level of responsiveness. Last seen normal at 11:30 a.m. Her initial blood glucose was a 2.8, and I administered two 15-gram doses of oral glucose. The other vitals all seem to be within normal range, and we should be there within 20 minutes.
What is her current blood glucose?
Her current blood glucose was a 3.8.
Thank you.
Next, we're going to be doing a thorough head-to-toe examination, just looking for any other injuries on the patient. Looking at the head, no pain or visible injuries on the face or behind the ears.
As found.
The spine is still normal there. Just coming down the neck, the trachea is still in place.
As found.
Perfect. Just looking at the shoulders there, no blood or bruising. Coming down the arms, no pain, no tenderness.
As found.
Perfect. Coming down the other arm, no pain. Perfect. Just going to be looking at the chest here. The sternum is still in place. Looking for equal rise. Going to be palpating 4 quadrants of the abdomen here. Looking for any pain, tenderness, or any other signs of injury. All 4 quadrants appear normal and soft.
As found.
Perfect. Just coming down the rest of the abdomen to the pelvis. No pain or injury. Visible injuries.
As found.
Perfect. Coming down the legs. No blood, no pain, no tenderness.
Legs are as found.
Perfect. The other leg. And then we're going to be looking at the back here. Just checking the spine. No pain, no tenderness.
All as found.
Perfect. Just going to auscultate the 6 points on the back there. Equal breath sounds on both sides there.
As found.
Just going to check the sensory motor functions and circulation. If I could just get you to squeeze both fingers there. Perfect. Motor functions are still present. Just going to be checking the cap refill. Present in both hands. Can you feel that there on that side?
Yeah.
Perfect. Can you feel this here?
Yes.
Perfect. We're just going to check that on the feet here. Perfect. Just checking the cap refill. Cap refill is there. Can you wiggle your toes for me? Perfect. Can you feel that on that one foot? Can you feel that on that foot?
Yeah.
Perfect. So we're going to rule out stroke. There is no one-sided deficits on the body. Next, we're going to be moving into our third set of vitals.
Actually, what happened?
Oh, yes, hello. Yeah, you had a diabetic emergency there. Your blood glucose was quite low when we picked you up. Do you know what happened? Do you know what was going on?
Yeah, I was doing my office paperwork and I took my regular dose of insulin. I forgot to have my breakfast actually after that.
Okay. Okay, well, we're going to get you looked after here, and we're just going to take you to the hospital just to make sure everything's okay there for you.
Okay.
Perfect. So just starting off with the GCS, We're going to give her a 4, 5, 6. She is alert and now orientated. Moving on to the rest of the vitals here. The SpO2 is reading a 99.
Still 99%.
Perfect. We're going to check the circulation here. Still at a...
Still strong and regular at 72 now.
Perfect. Respiratory rate?
It's about 16.
16, perfect. We're going to check the BP there.
Blood pressure is 118 on 74.
118 on 74. The skin still appears normal, warm, and dry?
Normal, warm, and dry.
Perfect. Pupils are?
Pupils are as found. Pearl at 3.
Perfect. And then the blood glucose level?
Blood glucose level is now 4.8.
4.8, so within that normal range there. Perfect. Yeah, so we're just going to be pulling into the hospital here in a second, and we'll get you looked after.
Okay, thank you.
Hey guys, this is Diabetic.
Yes.
What do you got?
Perfect. So this is Cherie. She is a 24-year-old insulin-dependent diabetic. She missed breakfast this morning just after taking her insulin. When we arrived, she was a GCS score of 446 with a blood glucose of 2.8. I administered a total of 30 grams of glucose, and she returned to a GCS of 15 about 10 minutes ago. She's allergic to penicillin and takes Synthroid for her hypothyroidism. Her most recent set of vitals were a heart rate of 72, respiratory rate of 16, BP of 118 over 72, and an O2 saturation of 99, still on a nasocanial at a flow rate of 4 liters per minute. And her current blood glucose level is a 4.8.
Great, bed 4.
Perfect.